Hi there, I'm Black Bright, broadcasting out the UK. Welcome to my channel. First time you're passing through. You won't realise this, but I talk about a lot of different subjects designed to inform, advise, and just basically to raise awareness. So today I wanted to talk about an immigration matter. It's for those of you who are thinking about visiting the UK. It's just hopefully a very short video. Before you would just buy your ticket, get on a plane. But now we have something, it's a bit like Esther, you know, like when you go to America, you have to complete this document before you can go there. And I think it cost a nominal amount, if 20 quid. In Jamaica, they've actually already started what the UK is doing now. So Jamaica well on board with this new documentation. It's called the Public Health Locator Form. So before you even get your ticket, it's recommended that you complete this Public Health Locator Form. Also, even though travel insurance is not compulsory, it's probably best that you have it and make sure it covers you for COVID-19. Or coronavirus. I don't know how they're going to word it, because COVID-19, I mean, they keep talking about COVID-19, but it's actually the coronavirus that we should be talking about, because COVID-19 is an acronym for Certificate of Vaccination ID. And 19, of course, is 2019. So you have to when they're using it interchangeably, it's not really right. And I did hear on one of these immigration sites that proof of vaccination is not required at this time. That is what COVID-19 stands for. It's the certificate of vaccination. So after you've been vaccinated, you have a certificate and it allows you to travel. At this point, you don't need it. So you do need the Public Health Locator Form. It's probably best, but like I said, it's not compulsory to have travel insurance, and make sure if you do have it, it covers you for coronavirus. That'll probably up the price a little bit. It wouldn't surprise me. And all passengers have to complete the Public Health Locator Form. If you haven't completed it prior to coming in the country, you will not be allowed in. So you would have wasted your money. Okay, and there's also, not only will you not be allowed in, but there's a £100 fine if contact information is not disclosed. So on the, I don't know how many of you saw that video that I did about the estranged wife who turned up in Jamaica, and the husband didn't want her there and she wouldn't let him go and all of that. Well, what she had probably done was to complete, they didn't call it a Public Health Locator Form, but it is a form that is designed that they can track and trace you. So what you need to put on that form is the name of the person you're staying with, how long you're staying with them, where they live, their telephone number and everything. And she probably only knew his house number or his address, which was obviously their own. They both lived there before she went to America. So she probably put that down because that is what you needed to have on the form. Now, if you try to get into the UK and you haven't got the name, the address, the contact number of the people that you're staying with that can be verified, you could be fined £100. So bear that in mind. So you need to know where you're staying. If you're staying in a hotel, that's fine. You just put down the name of the hotel and blah, blah, blah. And make sure you have the contact number and the street name. Sometimes, a lot of us, when we're booking a hotel, we put down the name of the hotel. We assume the taxi is going to know where it is. And so we don't put down the full address. Make sure you have the full street address and the postcode of where you're going to stay, even if it's a hotel. We've got lots of hotels with the same name. They're in different areas. Okay? So this is for people coming from the outside, coming into the UK. Are there testing entry requirements? No, they're not at the moment. Self-quarantine procedures are in effect if you come from certain countries. If I can find those countries, I'll put them in the description. So we do know that certain countries don't have to quarantine. All arriving travellers must have travel insurance that includes COVID-19 for the period of their stay in the UK. But like I said, it's not mandatory, but you just never know. It's probably best. Just supposing you do catch it and you're a foreign national, or you're a foreigner coming into the country, and you catch coronavirus and you have to be hospitalized, it's going to be pretty expensive. So it's probably best to have it. You also have to be aware that face coverings must be worn in confined spaces. By confined spaces, they mean the London Underground and railways, bus stations, airports, and I believe supermarkets also. You also will have to follow the social distancing protocol. It doesn't apply in Scotland, Ireland and Wales. Well, not that it doesn't apply, but their legislation is totally different from England. The COVID-19 vaccine is not available yet in the UK. And like I said, the UK proof of vaccination record requested to enter the UK in the future is not required yet. So they call it proof of vaccination record. It is actually COVID-19 certificate of vaccination. Visa requirements. UK visa requirements must be followed to the letter. Don't miss out anything. Just make sure you do it and you get it checked by somebody who knows. All embassies have restored services, so you shouldn't have any problem getting them to check your documents. Tourists are allowed to visit for up to 90 days without a visa, but that of course applies to certain countries. Not all countries allow you to do that. So the summary is, to comply, complete the public health passenger locator form, check if you need a visa to enter the UK, check all countries relieved from quarantine, and these are updated periodically. So make sure when you know you're leaving, you check. So that way you'll know whether or not you do need to quarantine, and obey all the UK health legislation protocol. And that's all for now. I did say I'd keep it short and sweet. Bye-bye.